Hi, my name is Lauren Lindsay. I'm a BS student at Rogers State University, and today I'm going to be doing a skin, hair, nails, head, and neck assessment. Today we'll be assessing a 52-year-old white Caucasian female. First, we'll begin with color. When assessing for color, you will look for anything, you'll be looking at their skin tone, their pigment, and look for anything that isn't coherent with their skin tone. So she has a pretty even skin tone, but you can see some dark marks, a few freckles, things like that. When you look at for color, you can also look at their fingers for yellowing in smokers that can indicate smoking. Also, if they're red, that can also indicate Raynaud's disease. Next, we'll be assessing for skin type. This patient is fair complected, so she would be at a higher risk for sun damage, which can be noted by the dark spots on her face. Next, we'll be assessing for skin trigger. When doing this, I will pull at the patient's skin at their chest and see how quickly it returns to normal on the chest. Less than 3 seconds would be considered normal. Any skin tinting, which would be staying at this state or going back to the chest slowly, would indicate severe to moderate dehydration. If that occurred, I would then ask the patient about a 24-hour diary with water intake. Next, I'll be palpating the patient's skin. I would like for the patient to be warm, dry, and intact. When I say dry, I don't want them to be diaphoretic. That could lead to anything that rubs together for skin breakdown, because it is rubbing against each other and there is friction, and like the legs or skin folds. I want them to be warm, their skin to be warm. If they're not warm, then that could be a signal of circulatory issues, and I want all their skin to be intact and there to be no excoriation. Now I'll be assessing the patient for multiple freckles. I will look in areas that are exposed to the sun, such as the hands, the arms, the chest, and the face. In adult males, I would also look at the top of their heads if they're balding, which aren't usually covered unless by a hat, so that could be an area with multiple freckles. Next, I'll be assessing the patient for moles. When looking for moles, I'm going to look for a few things. A for asymmetry, B for borders, irregular borders, C for color, any discoloration that's abnormal, D for diameter. Diameter should be less than 5 millimeters, D diameter, E for elevation if it's raised. So I would look arms, hands. This could also mean skin tags. So areas most common for this are the arms, the chest, the neck. I have an atypical mole. So as you can see, it's asymmetrical. It's not the same size. The borders are irregular. The color is only in the middle. On the upper and lower side of the mole, it has no color. The diameter is less than 5 millimeters, so in that area it's not considered atypical, and my mole is elevated. Next, I'll be assessing the patient for scars. When assessing for scars, you want to look at length and width of the scar, and I would also ask the patient why the scar is there, how they got it, if it was treated medically. This patient does have a scar on her left bicep area. It is from a melanoma biopsy. I would measure the scar. It is about 2.5 inches long, and it's not very wide. So I just document where it's at and how long it is in my chart. Next, I'll assess the patient for any autoimmune skin disorders such as psoriasis, which would be reddened areas. Plaque psoriasis, you would have silver, scaly flakes on top of the redness. Sclerodema would be like hardening of the skin. Hers is pretty soft, And then Raynaud's, again, you would look at their fingers. If they're blue, that could be a sign of a circulatory issue. Next, I would assess the patient for any rashes. a few types of rashes could be a butterfly rash, which would be across the patient's nose and cheeks, which could indicate a lupus flare-up. Another common one is poison ivy, which would be just red blistery areas that are irritated, and then chickenpox or varicella. The patient is over 50, so this would be a good time to educate the client on getting the shingles or herpes zoster immunization. Next, I'll be assessing the patient for acne. This could be on the face, which can pop up in just in blotches and spots, or individually. So she does have one spot here, but it looks like it's pretty healed up. Also, you can look on the patient's chest for any acne, because that's another common area, and the back as well, but it does not appear that she has any acne on her back either. Next, I'll be assessing the patient for any calluses on the hands, feet, or soles. The patient does have some calluses on the pads of her knuckles here. They're hard to see, but I can still feel the roughness on them. Also with his hand as well. Next, I can look on the feet. This would be a good time to look for bunions. I feel one here, and then I can see some dry skin here, and some calluses on the side. Also on this side as well. This would be also a good time in your diabetic patients to look at their feet for any ulcers or anything like that with any skin breakdown on their feet. Next, I'll be assessing the patient's fingernails. When assessing the fingernails, you're just going to look for a translucent nail and pink underneath. If you see anything different, such as clubbing or splinter hemorrhages or spoon-shaped, that could indicate disease, and that's something you would want to look into further and investigate. Now I'm going to look for any abnormalities with the nails, such as fungal infection of the nail, onychomycosis, which would just be a fungal infection. Typically it's seen under the on the toenails or under the toenails. I can't see in this patient because she has her toenails painted. Or acromelanoma, which would be like a dark freckle looking area underneath the fingernail. Next, I'll be observing the patient's head for any abnormalities. This patient is normocephalic. In microencephaly, you would see a smaller head. Sometimes in babies, you'll see hydrocephalus, which would be water buildup in the brain, all of which you would consult a doctor on, because this is abnormal, and this patient's head is normocephalic, and that's what you would want to see. Next, I'll be palpating the patient's head. I just want to make sure that there's a normal curvature. As I go to the back of the head, where the occipital lobe should be, there should be kind of a little hump, and then back down to the neck where it should be straight. In this patient, I don't feel any abnormalities when palpating, but sometimes in some people you could feel a tumor if it's on top of the head. But this patient, I don't feel any abnormalities. Next, I'll be assessing the patient's cranial sutures. When doing so, I want to make sure that I don't feel any soft spots where the cranial sutures are open. Since this patient is over 50 and an adult, all the cranial sutures should be closed. In babies, you'll feel a soft spot when palpating. Make sure you don't press hard on that, because that is their brain right there, and that could cause damage. Next, I'll be assessing the patient's face. I would look at their face to make sure that bones aren't sunken in, or the patient doesn't have a moon face, which would be, a very heavy, thick face, or a hypothyroid face where they've had corticosteroids and they're going to have that full face once again. I would assess for fetal alcohol syndrome. The patient would have epicanthal folds, a thin upper lip, a flat nasal bridge, but I don't see any abnormalities in this patient. Next, I'm going to be assessing the patient's neck. When assessing the neck, I'm going to ask them to look left or right. Left and right. I'm making sure that they have range of motion and making sure that there's no stiffness when doing this, pain or tenderness. Also, I would be looking at the neck for any JVD, jugular vein distension. With that, you would find that in heart failure patients, which would be something to know and consult a doctor with. Next, I'll be assessing the patient's lymph nodes. When palpating the lymph nodes, I'm going to use the pads of my fingers and palpate in a circular motion. When lymph nodes typically are soft, non-tender, and movable. Lymph nodes can range from firm, mobile, non-mobile, tender, non-tender, and enlarged. So in doing so, I'm going to start with the preauricular lymph nodes, which you'll find right in front of the ear, and I would palpate in a circular motion here. Next, I would palpate the posterior postauricular, which would be behind her ear right here. Then her occipital behind here, and near her occipital lobe. I would assess her superficial cervical here and her post-cervical here. Next, I would assess her deep cervical chain here and her supraclavicular right here. Lastly, I'm going to palpate the thyroid. When doing so, I will feel for her Adam's apple, put my fingers on either side. My left hand is going to displace the thyroid, and then my right hand will palpate for any tenderness or if it's enlarged.